So the diagnostic imaging test that I'm talking about today is a barium enema. Um, Overall, the unit clerk's role for this procedure and most other procedures would be a requisition form to send down to whichever department, a prep card or a guide sheet for procedures before and after, and arranging for the transport of the patient as well as the mode of transport, and communicating info about the client that may require specific care, so anything that they physically have to be hooked up with or things like that, or a language barrier. Um, a barium enema is a contrast x-ray that is used to look for changes and abnormalities in the large intestine or the colon. A normal x-ray is taken before the procedure to make sure that the colon is clear. Then liquid containing barium is injected into the rectum with a small tube, and it lines the walls of the colon. More x-ray images are taken after this at different angles. This helps to show the abnormalities because the barium allows the colon to more clearly show up in an x-ray as it's a hollow organ. So it lines the walls and highlights certain tissues so that different abnormalities or changes can be seen. This procedure is done in approximately 30 to 60 minutes in the radiology department by a radiologist. Some of the tasks that the unit clerk needs to complete depends on the doctor, like different dietary requests. Different doctors say different things, although they generally all have the similar effect. So a doctor could order fiber restricted diet until noon, then only clear fluid after, or maybe a full fluid, low fiber diet all day. Normally, the client will be required to take a laxative the night before, and probably also NPO after midnight. The unit clerk's job in this situation is to put those dietary orders through and request the laxative from the pharmacy if it's not already available on the floor. The department specifically that the other department specifically that the unit clerk needs to contact would be the dietary department about putting the client's existing diet on hold and then initiating the preparatory diet. They also might need to requisition for a laxative from the pharmacy, different laxative depending on what the doctor says.